On this Tuesday night, as COVID-19 cases multiply, restrictions mount, and so does defiance.
Our Etobicoke location will be opening for in-restaurant dining against provincial orders.
New pandemic protocols and pleas to get with the program.
What are we going to be left with if we don't get ourselves out of this dumpster fire?
Canada's vaccine timeline, the logistics, the contracts, and the promises we'll get it, but we won't be first. To go home for the holidays or be homesick.
My parents are really upset.
The dilemma for Canadians living abroad. And 2 years worth of rain in 2 days. A powerful cyclone soaks Somalia.
Global National with Donna Friesen.
Good evening and thanks for joining us. 1 month before Christmas Eve and with COVID-19 cases surging, the message from public health experts is limit who you come into contact with. And tonight, Alberta's Premier, who for weeks has resisted pleas to impose tough restrictions, has declared a public health emergency. Alberta has the most active cases of COVID-19 in Canada. More than 1,100 new cases were reported there today and 16 more people died. And yet it has done the least to curb the spread. Today, Jason Kenney announced effective immediately, indoor social gatherings are prohibited and kids in grades 7 to 12 will move to remote learning on November 30th. Heather Yourex-West has been listening to the Premier's late afternoon news conference. Heather, what else is covered by this public health emergency?
Well, you covered the main points, and really what's notable is what's not covered here. No businesses other than concert halls, community centers, and conference centers will be asked to close. Restaurants will be allowed to remain open, bars, you can still get your hair cut, you'll still be able to go to stores, you'll still be able to go to church. So we are really looking at some targeted, measured restrictions here, not at all the wide-scale lockdown that many in the medical community have been calling for.
Edmonton's Royal Alexandra Hospital is now seeing more and more patients sick with COVID-19.
This is happening. I mean, I worked last night. I saw it with my own eyes. We have so many more COVID patients in the emergency department. We have so many more COVID patients in the intensive care units. We are there, and this is just the beginning.
For weeks, doctors like Shazma Bintani have been calling on the province to take action to stop the disease's rampant spread. Late Tuesday afternoon, Alberta's Premier acknowledged how serious the situation in Alberta has become.
As we increase that capacity, it comes at a real cost. A cost to people's health, and I fear a cost to people's lives.
Schools for grades 7 through 12 will close to in-person learning after November 30th, and all indoor social gatherings are now banned. But other than concert halls and conference centers, no businesses will have to close.
We believe these are the minimum restrictions needed right now to safeguard our healthcare system while avoiding widespread damage to people's livelihoods. We are doing everything we can to strike that balance.
The Alberta government has not done any modeling since the spring, but a University of Calgary researcher has looked at the numbers, accurately predicting a month ago where we'd be right now.
I've seen that they form a exponential growth, which is what this virus does, and fitted them to the exponential curve. And by this, I could calculate the parameters. Here, the doubling time.
According to her analysis of the data as of last Thursday, cases in Alberta were doubling every 3 weeks, meaning left unchecked, the province could see 2,200 daily cases by December 8th and 4,400 by just after Christmas. But perhaps more troubling is what's happening in ICUs. As of November 19th, ICU hospitalizations were doubling every 2 weeks, meaning Alberta is likely to hit capacity in just days.
Honestly, I'm already scared about the coming weeks. We have missed the boat on this. We should have put in more restrictions 2-3 weeks ago.
And Heather, Jason Kenney has avoided ordering non-essential businesses to close the way other jurisdictions have done. Why does he think that's not necessary?
Well, Donnie, he spoke at length during this press conference about wanting to strike a balance, and he said that closing businesses and imposing a lockdown would be a wide-scale infringement upon fundamental rights. So the question now is, will these measures be enough? We have seen in other jurisdictions how half measures aren't able to bring the curve down, and that really is the fear that this won't bend the curve in a situation that is becoming increasingly serious here. Donna?
All right, Heather Yourex-West in Calgary tonight. Thank you. British Columbia has again shattered its daily record of COVID-19 cases. The province recorded 941 new infections in 24 hours. 10 more people have died, and hospitals in BC are filling up too. 61 people are now in intensive care. The pandemic rules vary from region to region, and some Canadians are not only ignoring them, they're encouraging others to break them.
Come on, guys. Enough is enough. We're opening. For anybody who's a fan of freedom and sovereignty, the right to choose what you wear, where to go, who to have over at your house.
This restaurant owner defied Toronto's lockdown and opened to in-person dining today. He got a crowd of supporters, but also a visit from the police and bylaw officers. And late this afternoon, Toronto's medical officer of health ordered his restaurant shut down. Meantime, in Nova Scotia, where 37 new cases were reported today, the Restaurant Association actually called for all restaurants and bars in Halifax to close to dine-in customers. Today, the Premier agreed, and as of midnight Wednesday, Halifax restaurants moved to takeout only. Gyms, art galleries, and casinos must close too. Organized sports must stop, and gatherings are limited to just 5 people.
Going forward, there will be stronger enforcement for illegal gatherings, including a $1,000 fine for every person who walks through the door.
We're doing it early to get out in front of this. If we look at where it's happened in the rest of the province, they've instituted these tough measures far later on.
Manitoba's Premier Brian Pallister is making no apologies for keeping his entire province under tight restrictions. 476 new cases were reported in Manitoba today, and 12 more people have died. No gatherings with people outside your household are allowed, and unlike in Quebec, there is no plan to lift that over Christmas.
I think it's dangerous what the Quebec premiers decided to announce on Christmas. I'm not trying to deprive people of a wonderful Christmas. I'm trying to make sure that this year we define Christmas differently.
Manitoba is cracking down on those who break the rules. 9 businesses have been fined $5,000 each, and more than 50 individuals got tickets for more than $1,200. As Marney Blunt reports, those who are sick and who have watched loved ones die can't believe how uncaring some people are.
Hospitalizations reaching new heights, intensive care units bordering on capacity, and more Manitobans losing loved ones to COVID-19.
It's not something you ever want to have to do. To say that you're ready to let your loved one go, that's pretty hard. You know, like, we're never ready, but it was time.
Jen Lambert's 80-year-old mother passed away due to COVID-19 this month. Lambert has also tested positive for the virus.
The thing that I found the hardest was not being able to just touch my mom's hand. And had I known at the time that I was positive, I just would have said to hell with it and taken my glove off and touched my mom's hand.
The dire situation in Manitoba has the province tightening restrictions on who you can gather with and which businesses can stay open and what they can sell.
So we can't have these number of cases, these number of deaths that we report to be our norm. We have to act now.
But despite restrictions in place, some still aren't getting the message. The province issuing 95 tickets in the past week, equaling about $125,000 in fines.
But it's not about the money. It's about preventing situations that hurt people.
For Lambert, she says it's time for everyone to move forward together.
Yes, we want to see our loved ones. Yes, we want to get together for drinks with the girls. Yes, we want to let our kids get together. But what are we going to be left with if we don't get ourselves out of this dumpster fire that we're in right now?
Manitoba's top doctor did offer a slight glimmer of hope this week, saying the number of contacts per case is coming down, something he hopes will reflect in our numbers in a week to 10 days. Donna?
Okay, Marney Blunt in Winnipeg, thanks. Well, vaccines are coming, and Canada has signed contracts to buy them. There are no facilities here to produce them, though. As Abigail Bimman explains, Canadians will likely have to wait until next year to roll up their sleeves.
We've signed a deal to secure up to 26,000 doses of a therapeutic drug from Eli Lilly.
The newly approved COVID-19 treatment was made in partnership with Vancouver firm Abcellera.
Distinctly Canadian.
Liberals are trying to focus on how great made in Canada solutions are for the pandemic. But vaccines can't be made in Canada, and the opposition hammered on that.
The United States and England have announced plans to roll out vaccines as early as next week. But what's the plan in Canada?
How many more months will it take to flatten the curve because this Prime Minister has been unable to rapidly secure a vaccine?
We recognize the disadvantage that Canada has of not having a domestic pharmaceutical industry able to mass produce vaccines.
The Prime Minister says that disadvantage is why Canada bought more doses of vaccines in development than most other countries. This summer, the government announced $126 million to build a vaccine manufacturing centre in Montreal.
We aren't sitting on our heels.
The procurement minister promises when vaccines eventually come to Canada, Canada will be ready to distribute them, with freezers, gauze, dry ice, and other purchases underway.
We have the capacity to store up to 33.5 million ultra-frozen and frozen vaccines.
Ontario's premier was happy with procurement today, with rapid tests now deployed in some long-term care homes and hospitals in that province.
I was up here jumping and screaming for 2 months to get these done, so I want to thank Health Canada.
But the looming vaccine question remains. When?
I can't tell you the precise timing.
Neither the top doctor nor the top politician would say when they'll be approved or accessible.
It is premature to start, crossing out, circling dates on a calendar.
Trudeau says Canada expects to receive doses in the first few months of 2021, but he won't get any more specific. Abigail Bimman, Global News, Ottawa.
American Thanksgiving is on Thursday, and this year it's hard to find hope. The coronavirus has infected more than 12.5 million Americans in just over 10 months. It has killed more than 259,000 Americans, nearly 20% of the global death toll. Records are breaking every day. Right now, the 7-day average of daily cases is more than 173,000, and more than 85,000 Americans are hospitalized with COVID right now. That's a record, too. And nurses and doctors are exhausted. You'd think those numbers and all those deaths would make Americans think twice before traveling for Thanksgiving. Some are staying home, but millions of others are on the move. Jackson Proskow reports.
They were warned not to travel or gather this Thanksgiving. Millions of Americans are doing it anyway.
I was a little anxious. I'm very paranoid when it comes to traveling, especially during COVID, because it's just a scary situation to be in.
U.S. airports have seen their highest passenger volumes since the spring, more than 1 million passengers per day. Doctors see a disaster in the making.
My concern is that people just don't realize how quickly this spreads and how easily it spreads. Most of the patients that I take care of will tell me that they don't feel like they did anything that was overtly risky.
Case numbers are now surging in 48 states. The spread of the virus is described as aggressive and rapid, according to internal White House documents.
We could have avoided some of what we're seeing right now if we would have done more stringent types of measures.
All those cases will inevitably lead to more hospitalizations. In many states, the system is already at the breaking point. On average, 1 American now dies of COVID-19 every minute of every day.
It's just wearing to come in and take care of these people and see a lot of people just not taking this seriously outside of here. If only they could see what was going on.
In North Dakota, nurses from the Air Force have been brought in to help with the crush of patients. Other hospitals are converting specialized medical units into COVID wards.
Our heart failure unit, we had to convert it to a COVID unit. That means all of those heart failure patients are being moved elsewhere, away from the nurses that are specially trained in heart failure.
To date, more than 12 million Americans have been infected. Estimates are that number will nearly double by the time Joe Biden is inaugurated as president in January. Job one for the new president will be taming the virus and distributing a vaccine. Work that will come too late to spare the U.S. from a dark winter of pain. Jackson Proskow, Global News, Washington.
News that the transition from the Trump to the Biden administration is underway perked up the stock market. The Dow Jones topped 30,000 points for the first time in its history, and it's on course for its best month since 1987. President Donald Trump took credit for that in brief remarks at the White House today, and his successor, President-elect Joe Biden, revealed his picks for key cabinet posts. The team includes the first woman director of national intelligence, Avril Haines. Veteran diplomat Linda Thomas Greenfield has been named U.S. ambassador to the United Nations. Alejandro Mayorkas is poised to be the first Latino to head the Department of Homeland Security. And Biden's top foreign policy advisor, Anthony Blinken, is set to be Secretary of State. John Kerry, a former Obama-era Secretary of State and former presidential candidate, will be the first ever presidential envoy on climate change. All of them will have to be confirmed by the Senate. Under fire and under investigation. Coming up, what French police are being accused of after breaking up a migrant camp. Police in France used force to clear out a makeshift migrant camp in the heart of Paris today. Officers used tear gas and pushed their way in. People were tossed out of tents, which police say were illegally set up. Hundreds of people were displaced. Critics say it was excessive use of force. The French Interior Minister called it shocking and has ordered the police chief to provide a full report. The outcry is happening while the French president tries to pass strict new security laws that beef up police powers. Opponents say they restrict civil liberties. The strongest tropical cyclone ever recorded in the northern Indian Ocean has slammed into Somalia. Cyclone Gaddy has triggered landslides and flooding along the country's northeastern coast. The storm intensified quickly, and it's the strongest to hit Somalia. 2 years' worth of rain is expected in 2 days in the driest part of the country. At least 4 people have been killed. Cyclone Gaddy packed sustained winds of 168 kilometers an hour. Threat to national security ahead, allegations of funds being funneled into Canada from Iran. Canada's spy agency, CSIS, is investigating alleged attempts by Iran to secretly wire millions of dollars into this country in violation of international sanctions. Global News has obtained documents that point to money being funneled from Iran to a Toronto currency exchange owned by an Iranian expat. As Mike Drolet reports, the money may have been used to conduct foreign influence.
Behind the massive doors of his North Toronto mansion, Iranian expat Ali Reza Ongai lives a life of privilege. But since arriving in Canada in 2008, his attempts at gaining Canadian citizenship have been put on hold as the Canadian Security Intelligence Service looks into his business dealings. Documents obtained by Global News show CSIS is investigating Ongai for assisting the government of Iran in the clandestine wiring of monies into Canada. The CSIS report alleges the money came from Bank Saderat, which the U.S. Treasury alleges Iran uses to fund Hamas and Hezbollah. CSIS assesses the funds to be in the millions, but for what purpose?
If the information in the report is true, it is unique in the sense that often when we talk about threat-related activities with financing, it is outside of Canada. So individuals sending money outside of Canada, often to support violent extremist groups. But in this case, with clandestine foreign influence, it may very well be activity inside of Canada.
The United Nations began imposing sanctions on Iran in 2006 in response to its nuclear program. Canada imposed additional sanctions in 2010, the same year Ongai opened ONG Currency Exchange in Toronto. To get around the sanctions, Ongai admitted to CSIS that money was transferred first from Iran to the UAE before making its way to Canada and into ONG's accounts. CSIS wrote that Ongai knows circumventing economic sanctions is clearly illegal and that he admitted he'd been doing it for 3 years. Ongai told Global News he doesn't support the Iranian regime and that the money was transferred for clients. Toronto lawyer and human rights activist Kaveh Shahruz says there's been rumors in the Iranian community about vast sums of money arriving in Canada for the purpose of influencing Canadian foreign policy.
And unfortunately, what they're finding is that, the Iranian regime extends its tentacles into Canada.
After ONG's registration was revoked in 2012, Ongayi became sole director of a company that sells surgical equipment. His finances remain a mystery. His first wife told the court in divorce proceedings he was worth $25 million, while he claimed to have earned as little as $7,500 in annual income. And while his latest appeal for citizenship was dismissed on November 9th, he told Global News he plans to continue fighting. Mike Drolet, Global News, Toronto.
There is a lot more detail on this complex story. You can read Stuart Bell and Sam Cooper's investigation on our website, globalnews.ca/globalnational. Christmas flights. Next, Canadians abroad consider their options for the holidays. It's hard to tell loved ones, I won't be home for Christmas, but millions of Canadians are not making travel plans for the holidays. As tired as we are of being told to find new ways to celebrate, this is going to be a quarantine kind of Christmas. If you can gather at all, it will be in small groups. And for Canadians living overseas, it's just not worth the trip or the risk. Redmond Shannon spoke to some of them.
The one Christmas wish for many Canadians who live in Britain is simply to get back home.
I've been in tears several times over the past month or two about not being able to go. My parents are really upset. My whole family is. And we've been trying to figure out ways to make this work. And it's not possible. And we understand it, and we understand why.
This will be Megan Laren's first Christmas away from her family in Kitchener. She doesn't want to put her parents at risk, and she can't work remotely, so quarantining twice makes travelling impossible.
Christmas is a big deal for us, and to not be able to be there, it's really, I think it's especially hitting my mum quite hard, my mum and my dad.
Instead, she'll spend the holidays with her boyfriend's family in England. Edwina Lowe, however, is flying from London to Vancouver on December 5th to begin 2 weeks of isolation.
As my birthday present, my mom's booked me a hotel to quarantine in. My aunt had cancer a couple of years ago, so obviously I knew that I couldn't quarantine with them.
Lowe has been saving up all of her holidays this year for the holidays.
Well, I'm going to cry. Well, my mom is like my hero. She's a single mom. She raised me and my brother on our own.
During the pandemic, Dave Matthews has been organising Zoom meetups for Canadians in London.
Some people are there every week, right? And people need to talk. And I believe it's very important. You know, a lot of people, especially during this time, they miss their family, they miss their friends, they miss going out, they miss meeting people. And, you know, mental health is a big issue during this pandemic. You know, some people underestimate it.
Matthews is isolating back in Canada for health reasons, but is still making sure an extra London meeting happens on Christmas Day so that Canadian emigrants don't end this loneliest of years feeling alone. Redmond Shannon, Global News, London.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada are these stunning images of the Northern Lights captured by viewers across the country. Canada offers some of the world's best views of the Aurora Borealis. It's caused by particles blasted out from the sun colliding with gases in Earth's atmosphere. But you can put all that science aside and just consider them magical. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.